Hi, my name is Aguirre Mtanous, and I'm going to tell you about our study called Mental Health Outcomes Associated with Applied Behavior Analysis in a U.S. national sample of privately insured autistic youth. We decided to go ahead and do this study because applied behavior analysis, or ABA for short, is one of the most commonly prescribed therapies for autistic kids in the United States. In other research, people have very, very different opinions about what ABA does. Researchers and providers say that it's good for language development and school, whereas autistic adults in research have mentioned that they believe that their PTSD and suicidality and mental health hospitalizations are directly linked to their experiences of ABA as children. So we decided to look into this gap between the two opinions and try to find out in a large national scale, does ABA have any connection with negative mental health outcomes? We found a large national data set that included private health insurance data. So this data were medical claims for visits and hospital stays. In this database, we found 34,000 autistic kids. Then we created two groups from this one large group of autistic kids. One group included children who had at least one ABA visit billed to their private insurance, and the other one included kids who didn't have any ABA billed to their private insurance. Then we did propensity score matching. Propensity score matching is when we find clinical twins that have the same characteristics, but they're not actual twins. We matched our kids on age, biological sex, where they lived, and their other mental health diagnoses like mood disorders or anxiety. That way, the main thing that was different between these two groups was whether or not they had ABA. Then we tested whether or not the two different groups had different rates of PTSD diagnoses, suicidality diagnoses, mental health hospitalizations, how many times they were hospitalized, and for how long. After doing this and examining the different rates and experiences, we found that autistic kids who received ABA had higher chances of being hospitalized for their mental health compared to those who did not receive ABA as kids. More specifically, youth in the ABA group had 30% higher odds of having had at least one mental health hospitalization stay, and about 32% higher rates of mental health hospitalizations overall than the non-ABA group. But we did not find big differences between the ABA and the non-ABA group regarding PTSD diagnoses or suicidality diagnoses. In other words, our research found that ABA was linked to more mental health hospitalizations, but not linked to more PTSD or suicidality diagnoses. This research will help autistic people change the focus from does ABA change behavior to what does ABA mean for autistic mental health. This information we found helps autistic people ask important questions about the safety and the fit of ABA for all autistic youths, kind of like at a blanket rate. They suggest that maybe we need to be very careful about how ABA is used, for whom is it prescribed to, and with what supports are in place. In the long run, we hope this work will push the field to design and test new therapies that support autistic people's mental health, autonomy, and well-being, not just their outward behavior. Thank you so much for listening.